Let me ask you a question. What price would you put on a human life? Well, according to the US, it's $7,000. That's the average yearly cost for health insurance. The US spends more on healthcare than any other country, yet ranks last in quality of care amongst wealthy nations, and still charges its citizens for treatment. It's a system run entirely by profit that overcharges patients by billions each year, and where the science changes depending on who is profiting off it. In the US, medical personnel are treated as celebrities, not professionals, where people like Anthony Fauci are seen as saviors to some and are cursed as villains by others. So why is the system so broken? Of course, it's got everything to do with money and how a handful of companies have turned healthcare into a $1 trillion scam that only values profits instead of human lives. To almost all foreigners, the US healthcare system looks like a complete dumpster fire. Yet to a lot of Americans, this seems normal, and to some, even kind of great. But in reality, this is far from normal. And first, I just want to share some stats that will illustrate just how bad the situation in the US really is. In Canada, a vial of insulin costs around $30, but in the United States, the same medication made in the same factory costs 10 times as much. In Australia, the HIV drug Truvada costs $8. In the US, well, it's $2,000. With such high costs, health insurance in the US is considered almost essential. But even when insured, many Americans still have trouble paying their medical bills. 63% reported using up most or all their savings to pay for treatment, and over 40% had to get a second job to just cover the costs. The high cost of healthcare is such a massive problem. It's estimated 2/3 of all personal bankruptcies in the US are tied to medical expenses, which amounts to over 500,000 families going bankrupt each year. But this isn't normal in the rest of the world. As of today, the US is the only developed country on earth without universal healthcare. And even in the developing world, many poorer countries already provide free healthcare to citizens.
Stopping it there, and welcome to Mika Reaction Reviews, where we react and review to things on the internet. And today we're returning with Sorelle Amore. This is probably the third time I've reacted to one of her videos, either on this channel or my Speak Freely channel. And I absolutely love her. Again, she is a very popular and successful influencer, YouTuber, speaker, commenter, whatever you want to call it. Fits in many genres. She again has two channels. One channel is focused on photography and traveling and self-care, and the other channel is focused on the economy, but how the economy affects everyday people through different policies, ideology, politics, and much more. And today she's talking about the corruption of the medical industry. But before we get to the rest of the video and the rest of my commentary, just a small update, and I'm going to be repeating this in the next few videos that I'm going to be uploading. But I have decided that I'm pretty much yeeting music off this channel. But do not worry, I am actually starting 2 new YouTube channels because I hate life and I don't want to live it. I mean, I like working, not in a dark way, okay guys? Like, I'm fine. But I decided that I'm gonna just start 2 new YouTube channels because I will know for sure in like 9 days. But I'm coming to the conclusion that my Speak Freely channel just probably is not going to get monetized. I've tried a couple times, I've appealed it. They've denied it with just straight out lies that don't make any sense, that I'm not going to really get into. I can see if I can monetize it one more time, and that will be the end of that. It will either be a yes or a no. So I'm just going to get ahead of it, and I decided, okay, fine. YouTube doesn't want to monetize that channel because I talk about things that are just against the narrative, and I do on this channel as well. The difference is I started this channel off with just doing music, and I think that's why I got past the sort of monetization algorithm overlords. And so I'm going to start another channel where it's literally just music. That's all it is, and it's just the enjoyment of music. Nothing political, nothing really deep, just celebrating the art of music, right? And the second channel that I'm going to be starting, I don't really know the genre to call it, but it's going to be called Anonymous, and it's basically me sharing stories of other people across the world in a way where it brings us together, because I feel like we live in such a divided society at the moment. It's kind of like a podcast, storytelling sort of type of thing. I actually really loved it. I already uploaded one video already, and that's basically going to be my passion project, and then I have the music channel. So I'm going to spam this, and I hope you guys can bear with me for the next week or so. Please, if you want to support, go subscribe to my 2 new channels. I will put the links down below. And please go follow me on Twitter so I can stay in contact with you guys. I will still do music on this channel periodically, but music that kind of like has a political message or ideology or something I really want to get into. But for just the love of music, it's going to be shifting on my other channel, and it's going to be called Music Reaction Reviews. Alright, enough of that. Let's get back into this video. I know that there is a lot of discussion and even debates when it comes to the medical healthcare that is America. There's so many people that love the medical health system in America. There's patriots that think it's the best and really shun the idea of universal health care and kind of always points out the negatives of universal health care. They use Canada a lot as an example, saying the really long wait lines or the long wait list that people have to be on to receive urgent health care and surgeries and life-saving health care, and the fact that a lot of the medical innovations and inventions and research is done in America because we have a more capitalistic type of healthcare system that we can use that money and do other good things with it, and other countries around us benefit off of our research. I'm not saying America is the only one that does that. I'm just saying that's usually the argument. However, I have to say that there is still something broken in the healthcare system in America, because at the end of the day, it's the business, and they're going to, when money is your bottom line, you're going to overcharge, you're going to do unnecessary procedures and x-rays and CT scans just to boost up that bill to make more money. It's the same thing with Big Pharma. It's the same thing with FDA. It's all just a very big conflict of interest, where if it's a business and that is your bottom line, you're going to do whatever it takes to keep making more money. And I think that's where a lot of the corruption comes in. And being outside of the US now for the last a little over 7 years, for the first time in my life, I'm able to pay out of pocket for healthcare. It's extremely inexpensive here, and it's good healthcare. Many of the doctors at the bigger hospitals in these countries usually went to very good universities. It's all modern healthcare, modern medical systems and stuff like that, modern technology when it comes to medicine, all the latest innovations. And that's why a lot of these Southeast Asian countries, or just Asian countries in general, have such a huge medical tourism, because people come here because they can't afford it in the West. That's a problem, all right? It's a problem if someone takes a freaking ambulance and it costs them $5,000 for a 5-minute trip that they might not even need it. I would also say the emergency healthcare system is also a little broken, because a lot of people don't pay those bills and it falls on the taxpayers. So I think there needs to be a balance here. And what that is, I don't know. But we're going to get back into Sorelle, and we're going to listen to more of what she has to say, and if she has a solution. Alright, so we're going to get back into it, but before you do, if you like type of videos, please like, comment, and subscribe. Hit that bell to get notifications when I do upload. All of that really does help with the algorithm, guys. And if you'd like to support the channel even further, you can donate. My PayPal me link is in the description box below and also in the comment section. Of course it helps, but you don't have to. You can just like, comment, and subscribe. Another great way to support this channel is either join my brand new membership program, different levels, different tiers, different perks, or visit my brand new merch shop. Links down below. And if you like, you can super thanks. Other than that, sit back, relax, and continue to enjoy the video. Alright, here you go.
Some examples include Iran, Botswana, Cuba, Rwanda, and Pakistan. Now, as someone who has lived her whole entire life in places with free healthcare, this seems insane to me. So why is the US still so resistant to something that so many people consider as a basic human right? As you might expect, it has everything to do with manipulation by big business and its health insurers, who are the first players in this big healthcare scam of America. This is a relatively normal medical bill in the US. Over $360,000 for an 11-day stay in hospital. Thankfully, this patient had insurance to help them deal with the immense cost. Firstly, the insurance company negotiated a discount on the hospital bill of around $260,000, leaving just $100,000 remaining. Insurance then covered almost all of this, leaving just $104 for the patient, saving them from paying a devastating financial cost. But here's the thing. The discount the insurance company negotiated is a scam created in partnerships with hospitals to make you believe that expensive health insurance is a good deal.
It's basically the same thing when they do with stuff like Black Friday. They put the price up first and then they slap 50% off to make you feel like you're getting a good deal, but you're not. They already raised the price, and they do this a lot with sale tactics. They'd even do this online. I've had online shops, there's literally apps and plugins that you can put onto your website that will just put the price up and then slap a sale sticker on there, or say something like, 3-day sale, or you got 5 more minutes, or it's gonna go back up to 100%. Like, there's all these really scammy, kind of sneaky sale tactics that people do to make it seem like you're getting a deal, but you're not really getting a deal. Or they put the price up and then raise the shipping and handling costs or stuff like that. So you have to pay attention to these things. But anyway, let's continue.
One of the main selling points of US health insurance is that insurance companies are great at negotiating prices with hospitals, potentially saving patients thousands on their bills. Until recently, it was a very closely guarded secret what someone with insurance would pay for a certain service compared to someone without it. In short, everyone just had to take insurance companies on their word. But in 2020, the federal government ordered hospitals to release the price lists of services they negotiated with insurers. And immediately, it was obvious why they didn't want this information to be public. At one hospital, a colonoscopy for a person without insurance cost $782, but with insurance, over $2,000, almost 3 times the price. Or at the University of Pennsylvania Hospital, a pregnancy test without insurance costs only $10, but if you're insured, that same test costs almost 10 times more. Or as one news outlet put it simply, in many cases, insured patients are getting prices that are higher than they would if they pretended to have no coverage at all. In other words, the insurance companies are basically full of. And the only reason that the discount looks so high that they've negotiated with hospitals is because they have a higher listed price in the first place, conning Americans into believing that they are getting a valuable service. Now, it is possible to negotiate these medical bills by yourself. However, this is another place where price manipulation happens so that the industry can ensure only insurance companies can play the game fairly. In one example, an uninsured man was billed for over $31,000 for around an hour of treatment. He wanted to negotiate a discount, but because he wasn't insured, he had to do this by himself. But even though insurance companies regularly receive an 80% discount for treatment at the same hospital, they refused to give him the same discount, offering him a maximum discount of only 43%. The reason? According to one doctor, it was because the patient didn't have representation. In reality, this is the main benefit of being insured in the US, so that a hospital will agree to give you the lowest rate on care because you're a member of the insurance company's club. Or as one author put it, if you don't buy health insurance, hospitals have agreed to penalize you by putting a surcharge of several 100% on your medical bill. And due to the fact that there are almost no laws requiring reasonable pricing in healthcare, hospitals can effectively legally extort money from patients with these penalties. Basically, hospitals and insurance companies act like a mafia protection racket, and if you don't pay up to the insurance companies for protection, you risk being bankrupted or having your life ruined by huge medical bills. Now, at this point, I'd love to hear your thoughts on how this compares to your own medical system in your own country. And if you are American, I'd love to know your thoughts on what is going on at home. Now,
all right, guys, you heard the woman. What has been your experience with the healthcare system as an American? Most people who watch me are from America. Do you think it's amazing? Do you think you have gotten scammed? Are you able to afford medical or good healthcare? And if you're outside of the US, how does it compare, or how do you think it compares to the American health system? Again, like I've said, when I was in the US, I could never afford to pay a goddamn single bill in my life. Like a medical bill, that's what I mean. But outside the US, it's very easy for me to pay out of pocket. Even when it comes to medication, a lot of times you can just go to the pharmacy, get the medication that the doctor recommended for even cheaper, even though it's already cheap at the hospital. Because unlike a lot of countries, Southeast Asia or South Asia, you don't need a prescription for a lot of different medications that you would if you were in America. So you can just go to the pharmacy and say, this is the list from the doctor, can I have all of these medications? And it's literally so cheap. A lot of retirees retire in India, Philippines, Vietnam, Thailand, because they have such a good medical healthcare system, and because they can afford all those medications. Sometimes you rack up in your older age. I have a friend that had intensive eye surgery that I would never be brave enough to get, even though I need eye surgery. Had his whole cornea, retina removed and replaced or something like that, the surgery cost a fraction of the price of what it would have if you'd gotten it done in the West. So I don't know. I understand people who praise the medical and the private healthcare system. And the thing is, I have no problem with universal healthcare if it's done right. But I also think within universal healthcare, there should be the option of having private healthcare, because they also don't think Obamacare was that great either. It helped like the lower class or poor people, but it screwed over people who already had healthcare or private healthcare, or screwed over the middle class. So I think it needs to be somewhere in between. But let me know what you guys think. Anyway, let's get back into the video.
In a moment, I'm going to share more about the insane price manipulation that is happening in the healthcare system. But first, I just want to mention we have an incredible newsletter of 65,000 people getting extra financial and freedom nuggets through beautifully written stories. There's a link down below. Okay, now back to the video. Now, aside from insurance, the price that Americans pay for healthcare is manipulated in many different areas. And a lot of this happens in what you would assume is basic essential healthcare. For example, childbirth and emergency visits. In the US, roughly 10,000 babies are born every day, and about a third of them by C-section. This rate of C-section births is more than twice the global average, which is generally between 10 to 15%. So why is this so high? Well, according to reports, this has nothing to do with the well-being of the mother and the child. And quite simply, it's because hospitals get paid $5,000 on average more for performing a C-section compared to a natural birth, meaning doctors are incentivized to slice women open, even when it's unnecessary. And do you want to hold your baby after that C-section? The hospital may bill you for that as well, adding $40 to your tab for skin-to-skin contact. This overcharging exists in almost every area of the medical system, even in life-threatening emergency visits. In the US, ER visits are coded by severity and given a number between 1 and 5. The higher the level, the more a hospital gets paid. Over the past 2 decades, hospitals and doctors have learned there's great profit in upcoding visits, and over a 7-year period, level 5 visits for injured people grew steadily by 45%, putting more money in the pockets of hospitals.
Stopping it there, I also want to say that in the last 2 years during the global virus, hospitals got paid more for each patient that they labeled coming in the hospital and being sick with the virus. Not coming to the hospital with something else and happen to have the virus. If they get marked down as being sick of the virus, they got paid more, and it just kept continuing. It's like upgraded. If they got treated for the virus, even if they passed away because of the virus, then they got paid more and more and more. Again, this is a conflict of fucking interest. But anyway, let's continue.
And really, very little can be done to stop this practice, because as one publication put it, the insurer isn't an exam room to know what transpired. Now, you might think that this apparent corruption is the fault of the staff themselves, but before you grab a pitchfork, let's look at the real culprits behind this profit mongering. And as you might expect, the suspects are the companies that I've spoken about many times on this channel before. Unlike most of the rest of the world, the entire US healthcare system is for profit, meaning it exists to make money, not to serve people's needs. Blackstone is one of the largest investment firms on the planet. In the US, it owns Team Health, the nation's largest medical staffing company. Basically, if you go to hospital in the US, chances are your doctor or nurse is employed by them. Team Health is known for massively overcharging customers, with prices higher than 95% of other providers and 9 times more than Medicare. And according to its own staff, this is all done by design, with one of Team Health's own executives saying the actual cost of treatment isn't a factor in how the company sets its prices, meaning Team Health can charge whatever they want for care, resulting in billions flowing back to Blackstone and the company's rich investors. Overall, Americans really only have the illusion of choice when it comes to their health decisions, because almost every publicly traded hospital, medical, and pharma company is owned at least in part by one of the 2 companies. The names are BlackRock and Vanguard, companies you've likely heard of before. And together, they're amongst the largest shareholders of the entire US healthcare system. Effectively, these companies have almost complete control over the entire US healthcare system. And it's really hard to imagine that these for-profit investment firms aren't abusing the system for their own financial gain. And whenever there is abuse, there's always a victim. And as always, it's usually the poorest people in society that suffer the most. Rising costs means that over a decade, the number of people without health insurance in the US has risen by over 35%, meaning many in the US don't seek healthcare when needed because they simply can't afford it. Increasingly, stories are circulating of Americans begging not to be taken to hospitals even when seriously injured, with some seizure sufferers going so far as to wear a bracelet saying "do not call an ambulance" because they can't afford the $1,000 plus cost of a ride to the hospital.
I experienced that. Like I come from, even though my mom was a nurse, my biological mom was a nurse, a terrible person, but a nurse. And even though we had healthcare, I think my mom sort of passed down that fear of going to the hospital because of medical expenses. And so I kind of was taught as a kid, like, you don't go to the hospital unless you're about to die. Like, you just kind of walk it off. It's gonna go away on its own, right? That's followed me as an adult, where when I was in Thailand, I actually got dengue fever one time, and even though I literally felt like I was dying, and it had to drag me to the hospital, and even once I got to the hospital, I begged to fucking leave because I just didn't know what the expense was going to be, which was nothing because it's Thailand. But I was still like living in that fear of how, like, oh my god, this is going to be expensive. The doctor was literally telling me, like, your fever is so high that you might start cooking from the inside out. And I literally slumped over in my wheelchair. I was like, nope, I can't afford it. Take me home. I don't want to be here. And like, my friends actually took me home, which I was like, why would you do that? I was delirious. I had a fucking high ass fever, and he just went and got me the medication. I ended up being fine, but that fear of the expense of getting medical health care has followed me as an adult. Now it's changing now that I'm older and I've been here for a long time now, and I know that I can kind of pretty much afford health care here. But yeah, I totally understand that. But let's continue. Sorry.
In the US today, 75% of women who seek abortions already live below the poverty line. But with the recent overturning of Roe versus Wade, economists say their situation is likely to get much worse, because it's most likely the poorest in society that will now be forced to carry unwanted pregnancies to full term or engage in dangerous medical procedures in order to abort, while wealthier women will be more likely to be able to afford to travel to a different state or country for an abortion, something that for those living in poverty might not be an option. So there is a lot of evidence to show that the US healthcare system is really broken, but there are so many Americans that actually adore the US healthcare system and support it wholeheartedly. And this has probably something to do with the billions of dollars spent every single year by the medical industry on advertising and PR. And this allows them to construct a narrative to keep things exactly the way they are. In the US, the medical and pharmaceutical industry spends more on lobbying than any other by a big margin, spending double what the largest industry does each year, ensuring that they can get laws written to ensure that they can make as much profit as possible. They also spend billions in advertising each year, attempting to convince Americans the system works. But if it worked, the numbers wouldn't tell such a depressing story. Among the world's wealthy nations, life expectancy in the US is dropping the fastest. It's the only developed country where the maternal mortality rate when a mother dies during or after childbirth is increasing, not dropping. Where medical error is the third largest killer in the country, accounting for 10% of all deaths each year, and where 92% of physicians admit they make decisions to avoid lawsuits instead of primarily for the good health of patients. In short, the reality is this. Where I live in Iceland, or the country I was born in, Australia, or practically any developed country on Earth, I could cut off my finger on purpose and not worry about the financial costs. I would just go to hospital and get treated, and I wouldn't have to second guess whether I have insurance or not, and I wouldn't have to worry afterwards about a medical bill coming in and potentially bankrupting me. However, it is in the United States where this is almost exclusively not the case, and hopefully by now you can see who is responsible for this situation happening. So let me ask you again, what price would you put on a human life? Well, according to the US healthcare system, it seems that no price is too high. Thank you so much for watching.
Alright, that's it guys. That was Sorelle Amore. Please go subscribe to her channel. She's absolutely amazing. If I forget to put the link, just ask me and I'll be happy to give it to you. And of course, I'm not trying to take away from her hard work that she did on this deep dive, just reacting to it so we can come together and have a conversation. I believe America, it could be other countries, but I know America is one of the only countries that allow pharmaceutical companies to advertise to American people, which is corrupt in itself, because if you don't know, when it comes to medical trials, the pharmaceutical companies are the ones who do the trials themselves. There is no outside independent source that does these trials that has no connection whatsoever to the big pharma or the pharmaceutical companies that's creating this medication, right? They are completely within their right. It's completely legal for them to withhold any negative effects of that trial or neutral effects of the trial, meaning it does nothing to help the patient, right? They only publish the good effects of that trial, and a lot of times they have ghostwriters who will write up the medical papers and then pay off a doctor or a medical paper to kind of like put their name on it, to co-sign it, so it looks like it's all on the up and up, and it's really not. And also, there's no law that tells them they have to tell you whether a medication has been rebranded, or if it is rebranded, that it's been tested for the thing that it's been rebranded for. I was on antidepressants of a medication that was rebranded as an antidepressant, but it was originally an anti-seizure medication, and it made me extremely ill, and the therapist who gave it to me had no legal obligation to tell me that. So for pharmaceutical companies to be able to advertise their own bias is fucking insane. Again, I don't know what the answer to all of this is. I think maybe there should be, I don't know, some sort of more universal health care that's done better than what Obamacare was, but still allowing people to keep their private health care if they do so. But tell me what you guys think in the comment section below. Please like, comment, and subscribe. Hit that bell to get notifications when I do upload. All of that really does help with the algorithm, guys. And if you'd like to support the channel any further, you can donate. My PayPal me link is in the description box below and also in the comment section. Of course it helps, but you don't have to. You can just like, comment, and subscribe. Another great way to support this channel is either join my brand new membership program, different levels, different tiers, different perks, or you can visit my brand new merch shop. Links down below, and links to all of the alternate platforms I'm on, my socials, including my Twitter, other ways to support me, and other ways to contact me for business is always in the links down below. And if you like, you can super thanks. I also have a second travel vlog channel. I travel as a lifestyle or I live abroad. If you'd like to know where I am in the world, you can go to the description box below. Also in the comment section, hit the link, go subscribe to my travel vlog channel, and or follow me on my travel Instagram. My stories is usually what's most up to date. And again, if you would like to follow me on my other channels and my other ventures, the links are down below. My Speak Freely, my Anonymous, and my Music Reacts channel. Please support, guys, and you guys have an amazing day. Bye!